Earlier this month, a meat inspector at Australian Food Group in Laverton North tested positive for coronavirus. That man says health authorities did not ask him where he worked, and the company only found out because he self-reported 3 days after that positive test. He'd also been riding in Ubers and catching public transport in the days leading up to becoming sick. Despite this, there was a significant delay, he says, in health authorities asking who he'd been in close contact with. Now, this company, Australian Food Group, employs 60 people and provides pork to Woolworths. It claims the health department did not provide proper instructions on how to proceed despite multiple phone calls to them. Instead, it took it upon itself to perform a deep clean of its operations and has now been told they can continue, that only close contacts at the facility need to be tested. This is obviously a major concern because of the mishandling of the cedar meats cluster, which eventually grew to 111 cases.
And Pat, the number of Victorians in hospital has surged.
That's right, Pete. 85 Victorians now in hospital, 26 of those in ICU. And it's not just the elderly among the seriously sick, also a man in his 30s and 4 people in their 40s. 21 Victorians also on ventilators. The Chief Health Officer warning these numbers could increase by the hundreds in coming weeks as the number of cases continues to surge.
We have over 1,800 active cases in Victoria. That's a really significant number of people with coronavirus. And it does mean that in the next fortnight, we're going to see a number of these people who will require hospital. There's often 10 to 20% of all coronavirus infections who require hospitalisation.
Sutton hasn't ruled out imposing even tougher restrictions on Victorians if the current lockdown doesn't have the desired effect.